Mr. Park is a graduate student in the Department of Economics, involved in ongoing field projects in Liberia and Malawi. Mr. Park's presentation title today is Measuring the Impact of COVID on Households and Markets in Liberia and Malawi. So David, over to you.
So this is a joint work with many other people, as shown over here. Many of our are affiliated with UCSC here. So I'm glad to be the one presenting, and yeah. Okay, so first of all, you may all know, but Africa is probably one of the area that has been not affected as much as other part of the world in terms of number of COVID-19 case counts. But like many African countries also took early action of like issuing lockdown orders because of the existing high level of poverty, and also their like limited health infrastructure would not be able to handle like any like more than modest level a number of like patients need to be hospitalized or so. However, it's also ambiguous how the peoples in the rural areas in Africa would be affected. One could argue that they could be hit harder than other populations because mostly they're in the labor. Most of the labor force are in the informal sector. The government capacity is limited, so for example, they can't really like identify beneficiaries and send out those income checks or some kind of like emergency money to those people or so. And so these are all factors that could argue that they could be hit harder. And and on the other hand, you could also argue that they're not going to be much affected because like some of these like usually considered as hindrances, for example, like they live in rural villages, remote and quite far away from the cities or roads, and their heavy reliance on subsistence farming might make them independent from any like disturbance in the global food supply chain or so. So anyway, it's ambiguous. So to measure the effects on this pandemic on these type of populations, we have been conducting these phone surveys with an existing study sample in rural Liberia and Malawi. And this includes about 2,000 crop food vendors in the markets and about like 1,200 households living in rural villages in these two countries. So just to kind of give you a brief overview of the project, I mean, Liberia and Malawi, they're the two of the 10 poorest countries in the world, one in East Africa, one in West Africa. Both countries have currently have modest case counts of COVID-19. This is the number I put as of today that I scraped from the website. But these two countries also differ in how the government is respond or allowed to respond. Because while in Liberia, the stay-at-home orders has been strictly enforced by the government since early April, and in Malawi, the government initially issued lockdown orders, but it was like right after it was soon overturned by the high court. So currently they have like no lockdown orders issued by the government or so. So today I'll share some preliminary results from our ongoing data collection. We collected maybe we're now on the first 3 weeks of data collection. So just to kind of give you like some like punchline of the results that we have here is that we do find some high compliance preventive measures like social distancing or like washing hands and such, and even in Malawi where there's like no like strict like lockdown imposed on them. And when you look into the business outcomes on the crop vendors in our phone surveys, we do find like a more than 40% decrease in their profit, for example. And the third one, as some outcome that we would naturally be interested in, like we're worried about, but we at least yet like we find like no significant no like effect on food prices or food security of like households in a study sample. So okay, I'll just show you some tables here. Like for example, just like all the numbers over here, like unless specified otherwise, it's like a mean of a binary variable. So you can take these numbers, for example, as like a proportion of people who falls into this category. So as you can see, like many are aware of this virus, and one thing important is that most of the people over here in the sample, they're worried about like getting affected, so they are taking this virus quite seriously. And this is some like activities or public services that are restricted or closed after the COVID outbreak. And you can see in both, sorry, not in both countries, but while in Liberia, most of the services are restricted or closed. In Malawi, you can see like it's much less likely. But of course, the school and the religious centers are exception. Okay, and probably in this table, I want to show you that like even with the like the stark differences that you saw on the previous slide, uh, people in both Liberia and Malawi are taking this virus and this outbreak seriously, and they are taking all these preventive measures to try to like prevent them, prevent from getting these diseases. So, for example, like I don't know, like most of the people are like these like maybe first rows are all about more kind of social distancing measures, and you can see they're quite high in terms of compliance. And uh, like wearing a mask is something different. Like for the CVP, so by the way, CVP is a crop vendors and household phone survey. This is like HHPS. So this is like conditional on like being a crop vendor, like actually having to be in the market and selling food, like pretty much like half day of the day. It's quite high in like Liberia in terms of wearing a mask. And these are like the business outcomes that we surveyed for the crop vendors. There's so many stuff to discuss here, but for this time, for the sake of time, I just want to highlight here that the profit, the last row over here, it has decreased quite a lot since before the lockdown, which was basically like February, March. And you can see about slightly more than 40% decrease in their profits. Okay, yeah, and just like this is food security, again, there's like so many outcomes here that, yeah, I need to like, I can't really discuss out here. All these outcomes like HDDS, FCS, household hunger scale, or the food, these are all the outcomes are kind of standard measures when it comes to measuring food security on households. And this is one income, I'm sorry, like one outcome that I want you to focus on. It's the fourth row. This is the index outcome that's normalized on the February numbers. And in this, so first of all, this is very short-term effects that we're trying to find here. But if there's anything in the short term, we actually find like some improvement rather than like a decrease in food security. So this is my last slide. And this, like, we also wanted to look into the food prices before and after the COVID. And as you can see, like, except for a few items, we don't find like that much significant effect on food prices. So, but again, like this is like a very short-term result effect that we're showing to you. So we're going to keep an eye on this, and we're also looking forward to see like what happens in the midterm, longer follow-up. So thank you.